I'm glad to be here today as we continue working together, collaborating together on our swine health initiatives. And you got to bear with me. I do have a little cold, and my hearing's not the greatest right now. And so as I go through this, if I don't hear you, just please speak loudly as I go through and answer questions and stuff. So I'd like to give you a brief overview of our swine health programs. It's been a very busy year within us. We've been collaborating on PEDV. We've been working on swine health activities and enhancing our surveillance efforts. And we need to work with you so we can get that input on what is our next steps. How do we continue to move forward to make sure we're meeting the state's needs, make sure we're meeting all of our stakeholder needs as we go forward. I know we're really short on time, so I'm going to try to speak very quickly and go through some of these slides fairly fast, because some of these are reviews of what we had in the past. But this is kind of give you an update of some of our surveillance activities. We do surveillance for pseudorabies. Pseudorabies is a regulatory disease that we work with the industry, with the state. It's a cooperative disease where we work together to protect the commercial swine industry from pseudorabies virus. And with that, we have various surveillance streams. We have implemented streams in our diagnostic labs called more sow surveillance, market slaughter surveillance. We're doing identification of feral swine, and each one of these streams have a different objective. Some of it's for rapid detection, some of it's for demonstration of freedom. And so out of this last year, we collected 276,742 samples. And with that, we are getting states submitting more higher risk samples. This is great. We're doing tracebacks. We're coordinating the tracebacks because we are receiving positives out of some of those higher risk samples. We are identifying herds. Pseudorabies is not eradicated from the U.S. as a domestic swine population. We've eradicated it from commercial herds, but we still identify it in those swine herds that are exposed to feral swine. And we have some states that are dealing with that right now, where we've identified those transitional feral swine exposures. But out of our surveillance system, it's doing as it's intended. 99% of our samples we collect are negative, and with that, we still have that risk, and that's feral swine. 21% of the feral swine samples Wildlife Services collected last year ended up being serologically positive for a pseudorabies virus. That might be in your state. It might not be. But we consider them a risk because they do contain the virus and can spread it as a potential vector. And we're doing some nice stuff with that Wildlife Services data. With that, folks within our STAS group out in Fort Collins are using the feral swine data and looking at some of our using NOMS data, combining them together to try to figure out where some of our areas of concern are. And we do have things, and this is some of the nice stuff that we can start doing when we get into the comprehensive surveillance activities. When we get that data coming in, we can actually use it to map out and find what are some of our higher risk areas where we utilize surveys from NOMS that say, yeah, they've seen feral swine in the area, and small producer surveys, and overlay it. So this is an overlay map with feral swine data, and it's not saying that there's any risk for certain diseases. This is just kind of saying where the NOMS data shows that we've had producers say they've seen feral swine, and they're small producers, and overlaying it with the feral swine where we know where feral swine are. And so we can start to overlay that data to provide value to you as stakeholders. Where might some of our risks be? And with that, we can use that data to make maps like this, but there's also improvements we need to do to continue to make sure we're protecting you guys as stakeholders. We're looking at working with SIA to do a tool for assessment innovation options. We would like to do this in fiscal year 2014. As part of the comprehensive surveillance activities, look at our surveillance. How can we make them more effective? How can we make them more efficient? How can we target them to get the sample that we need to make sure that they're meeting our economic and stakeholder needs? We're collaborating with industry on sample reduction initiatives. A lot of our samples in pseudorabies are taken from large commercial farms through the slaughter surveillance system. Are those samples necessary ones that we should be collecting? Are they the highest risk samples that we should be collecting? And so we're trying to work with industry right now and looking at those slaughter surveillance samples and maybe make some modifications there. We're collaborating with states to get more high-risk samples. You know, if we look at where our risks are, is looking at that map that I just put up. Are those areas that we should be collaborating to try to get more higher risk samples from smaller farms, from small slaughter plants, from markets? So we're trying to update that risk of high-risk states. We're trying to update that list of states to get those high-risk samples because we're collaborating with states like Texas and providing money through NALN and trying to get more higher-risk samples so we can get that data to provide that assurance to you. So we're trying to capture that data. We're also trying to capture more identifying information on some of our market samples, our meat juice samples, and our NALN samples too, because we got to have that information and that premise data, that information to know so we can provide those reports back to you. Switching gears to swine brucellosis, there again we have our cull sow boar slaughter surveillance. We're also testing in feral swine. Something that I can't say is going to happen next year is we're trying to look at ways to and testing methods to implement this into the NALN system. We're also collaborating with industry again on our sow boar surveillance activities. There again, are those samples collected from cull, our major cull sow boar plants? Are those the necessary ones we should be taking? What is the risk in the commercial industry? So we're working with them to identify efficiencies, try to make our surveillance programs as efficient as possible to meet your needs. And we also will probably incorporate a TAIO type assessment into the comprehensive surveillance activities that our folks out in Fort Collins are working on. Just to give you a quick update on classical swine fever, we have 5 surveillance streams that we're testing for. The surveillance program is going very well. We do collect samples from across the United States for classical swine fever. We do test for it in our NALN laboratories. Last year, we tested within our surveillance streams. We tested sick pigs submitted to diagnostic labs, about 2,200 of them. Slaughter swine that met certain case definition. We tested probably 2,200 of them approximately. Swine with high probability exposure, so these may be swine such as garbage feeding swine, swines that have maybe a higher risk of exposure just due to some of their management practice they have. We tested almost 4,000 of those swine last year, and we also tested feral swine in case they're roaming around in garbage or other areas and eating places because they're considered a higher risk. And the last stream is foreign animal disease submissions, and I'd like to point that out to states and industry out there, and even with the highlighting importance of PEDV and importance of regulatory diseases and reporting diseases that we see, classical swine fever could appear like any disease out there. And yet, with this highlighted effort for other diseases out there, we still had 0 swine submissions last year for CSF under FAD submissions. And that's something I think could be an improvement where we can work on together to identify, because you guys on the ground are producers and practitioners. If we did have a foreign animal disease, they're going to be the first to see it because they're going to call their veterinarian. And if we're still getting 0, that's something I feel like is something that we could work on together and implement forward. So things for improvement, we're going to try to improve our data quality. There again, we still get samples a lot of times reported with not even a state of origin to us. So we're working on improving data quality. We're working on continuing efforts to transfer serology so we can implement a CSF serology into the NALN labs, and that's through the NALN group. We're promoting form usage, so when we get our samples in, we can utilize the correct forms for collection of samples. There again, so we can get that accurate data back, and that's something we're collaborating with the states with. And we're exploring different CSF testing platform opportunities that we can maybe utilize in the NALN labs for a rapid detection type opportunity out there. Influenza surveillance, it's our non-regulatory disease. The influenza surveillance was started a few years ago after the H1N1 pandemic finding, and so since this data chart kind of shows some of our data since 2012, and we've seen this last year in fiscal year 2013 there were 21,725 samples submitted in from 4,991 accessions, and most of our samples coming in from influenza surveillance are from the diagnostic sick pig submissions, where there's almost 21,694 of them. So there's very few of our accessions from public health investigations or sick pig concentration points and commingling. And we're collaborating, industry, states, and CDC, and all of us have collaborated very well for fairs and looking at sick pigs and got the information out, fact sheets on SIV, but influenza A virus and swine type activities and information out to the fairs. And we still see some of those sessions coming in, and it's good that we haven't had a outbreak in through that like we've seen a few years ago. This is just kind of another bar graph showing our accessions and how they've gone up. Recently we've had a big increase in accessions coming in through our known lab. There again in 2013 there were 21,950 samples of influenza A virus in swine submitted, and out of those 4,991 accessions. And this is fiscal year 14 to date, and this to date is showing that we've had 11,000. We're on track of actually beating this 21,000 right now, because that's our fiscal year to date. Do you have a question, Butch?
Troy, is that red bar represent our industry, or most of those samples coming from the Midwest, or are we looking at influenza everywhere?
That red bar is representing the number of samples coming in, testing at the core known labs that are doing influenza A virus in swine testing.
I guess my question is, are any of those coming out of the southeast?
If there are known labs testing out of the southeast, like North Carolina and other places where we have our known labs, that data is collaborative of everything there.
So these are just tests submitted. These are not positive.
Right. This slide here is talking about our positives. This is fiscal year 2010 through 2013. In that year, we've had, that chart shows 1,579 influenza A positive accessions have come in since 2010. We got it separated out by H1N1, our H1N2, which is the blue. The green line is H3N2, and then mixed. About 54 of the accessions throughout the years have been mixed accessions, but 519 of these accessions are the red line, which is the H1N1. 380 accessions were the H1N2, and 286 accessions were the H3N3. And so that's kind of an outline of what we're seeing for actual positives, to answer your question there on the number of positives that we were seeing for the influenza surveillance program. It's a collaborative effort. It's a program that we're still getting very good data, so we can provide data to you as industry on what's occurring out there in the industry. Like I said, it's been a very busy year within veterinary services, and we've had a lot of talks on PEDV this morning. Since it was confirmed at NVSL in May, veterinary services, we've been cooperating with the states and industry as you guys are stakeholders, where we're holding conference calls to keep you guys informed and all the states informed on notifications. And we are very actively participating in doing risk assessments that Lisa just talked about. We're doing diagnostic testing. We're assisting in those epidemiological investigations. There's Dr. McCluskey with his group has been very adamant in helping identify the disease and working with industry to help determine the route of disease spread. We have been there partnering with you to identify those questions and try to get answers so we can help and support the industry as needed. We're also doing disease reporting, which is very important that NALN has been doing. NALN has implemented a system to get that information out and provide those weekly reports so you can use it as a baseline of the data that we receive anyway to understand what PED is doing out in the industry on a number of cases coming in. And this is just kind of a map that shows some of the things that we are doing within USDA of the map of positive biological accessions coming in. And this takes a lot of effort among all the groups to get this from all the labs, get it put together on a chart and send it out every week of that information. And it's something that we're doing to help you guys as stakeholders and help you guys as states so you can understand what's going on with this disease out in the country. This is another map of biological accessions, a positive reported each week, and this is something that we are putting out to you as for guidance, and so you can have an understanding of what's going on in the disease to provide information to our stakeholders. so you can provide value from the accessions coming in. I'm going to kind of switch gears. I just kind of gave you a talk about some of the disease programs overall. I'm also going to talk about, last October, there was a resolution at USHA about comprehensive integrated surveillance. And I'd like to talk to you a little bit about comprehensive integrated surveillance. And so this part is kind of titled Collaborations to Achieve a Result, because this is a collaborative effort. We don't do this alone, we do this together. And I think one of the first things we got to talk about when we talk about SIS is what is comprehensive integrated surveillance. And it's that standardized data collection and information management approach that facilitates design sample targeting in response to multiple and evolving swine health information needs. And that's a big definition, but it allows us that flexibility to get to that design sample targeting needs. And with that, we need that data to go behind there to get you guys the best results of so we can show that we have comprehensive integrated surveillance. And so our surveillance streams are here. We have been implementing SIS for a long time, so we're working on enhancing SIS. We have a lot of surveillance streams that we're already doing. This slide is very busy, very hard to read, but I put this in here to show all the different surveillance streams we have, the different diseases we're testing for, where we're testing, the targeted populations. This is all part of comprehensive integrated surveillance that we have implemented. That's been implemented for many years. And so we're working on that enhancement of SIS to take it to that next step. And that's where we need your guys' support and stakeholder support in moving, because a lot of these streams we're collecting in already. It's just providing that other information to provide value to you as stakeholders. And so this just kind of gives you an overview of where we're testing and what we're testing. And I know it's hard to read, but I'd be glad to show it to you afterwards, or if you have other additional questions on this. So SIS activities, I gave you the disease updates of our testing for pseudorabies, swine brucellosis, classical swine fever, our non-regulatory diseases. We're also doing planning for implementing pilots for future FAD active surveillance activities. We've been doing the passive surveillance for a long time. Now we're looking at doing active surveillance. And then we have our non-regulatory diseases, such as influenza A in swine, where we're getting that information and providing it to you as stakeholders. We have completed a lot of these tasks that are necessary to enhance comprehensive integrated surveillance. We're reporting to stakeholders, such as that PED map that you just seen. We validated certain tests for ASF, CSF, and PRV, FMD. We've collaborated with states and industry on pilot projects to get that data, baseline data on what we need and what we found out, and to move forward. And we have initiated discussions on data standards with states, and we need your collaboration together to move forward and take that to the next level. We've also working on developed surveillance pilots for FMD and ASF. We've developed the surveillance strategies already, and in the near future we'll be rolling out information to stakeholders on our FMD and ASF surveillance pilot. And we've developed sample collection testing messaging through the known labs. All that PED information comes in. We're getting over 4,000 records every week from all the known labs just on PED alone that's coming in that we have to compile and put together to get those reports out. That's part of enhancing SIS. That's part of getting that data flow to come in so we can provide those reports out. But with that, there's always room for opportunities. Like I've been mentioning all along, there's opportunities to work on and there's things we're working on. And that's making sure we have that consistency. State support on individual premise data and sharing, it still varies out there. And so we're working on trying to get that consistency, but we need your support as states and stakeholders to continue that forward. Continue discussions among parties and sharing premise information with VS. There is still concerns out there among all parties. So we have to get those discrepancies and all figured out so we have consistency among all of our programs. Testing efficiency and targeting testing. Comprehensive surveillance is not testing every sample for every disease. That's not part of comprehensive surveillance. It's part of targeting to get the right sample for the right disease that has the most value for us to test, because we're trying to make things more efficient. And working on information technology infrastructure so we can capture that information and report it out in a way that's beneficial to you guys as stakeholders. So we cannot implement comprehensive integrated surveillance alone. nor can the states, nor can the industry. We have to work together. This is a partnership among all of us together, so we can get that information out in the best way possible. It's a unified system where we need that partnership and support from all stakeholders for it to be effective. We can't leave a certain state out or certain states that don't want to share data. We have to have everyone together, so there again, we have to have that value. And to date, we need more access to premises data, and all parties must reach consensus on ways to share that premise identifiers. That way we have a consistent way of getting that data, so if we do get it, we can trace it back. So our next step is to continue those collaboration with stakeholders and enhance our surveillance by adding those future diseases of concern like FMD and ASF, which will be coming down really shortly. And we're going to continue to collaborate and work with industry and states to overcome those data constraints.